what happens if these implants, fail? They usually work for 15 to 20 years, right? So what happens after that?
It's not like, all of them fail between 15 to 20 years. So if you take 20 years, which you have mentioned, that 82% of them are surviving. The indication for knee replacement is pain, and pain is the indication.
Patients might delay their surgery because they might be afraid about losing their career or something.
Treating an athlete is completely different scenario. We have to get them playing in the next season. Maximum is only one season they can afford.
Voices shaping the future of medicine. Stories, knowledge, experience. More for life.
There are certain things in our life that we rarely think about. Things like walking freely, climbing a staircase, or just moving around without pain. These might be normal things to us, for many of us. But what about people who is having severe knee pain? It might be real struggle for them. Hello, welcome to Project Heal, and today we are going to discuss a solution for this knee replacement surgery. So joining us today is Dr. John T. John, Head of Orthopaedic Department, Lourdes Hospital. Welcome, Doctor.
Thank you, Sona, for having me here.
Okay, so let us start with the very basic questions that many people has. So when we hear the term knee replacement surgery, is it like the whole knee is being replaced, or is it just the damaged part?
Yeah, it's basically, something in between where, we are removing the damaged cartilage and we'll put something like a cap on it. It is not that we cut the entire knee joint and put a new knee joint. We are, we have got some special instruments. With that, we remove all the cartilage according to the, system which we are using, and we'll put a cap. So that is the knee replacement as such.
Okay, so I think you just mentioned about implants, putting a cap. So what happens if these implants, fail, or they usually they usually work for 15 to 20 years, right? So what happens after that? Do we need a revision?
So you should be always, positive. It's not like, all of them fail between 15 to 20 years. If you have look at the studies of knee replacement, we have studies which of 20 years and 25 years follow-up of patients which have come. So if you take 20 years, which you have mentioned, that 82% of them are surviving. So if you think about the other way around, only 80% are failing. So 82% of the knee replacement implants are still surviving at 20 years. So it's not that, they fail at 15 to 20 years, they work. It is just like you think about, the life expectancy of each one of us. Some, normal life expectancy in Kerala for a male is 72 and for a female is 78. So nowadays, most of the people live more than that. And there are people in between, outliers, you die before that also. Same thing, most of the knee replacement implants survive. So even if it fails, we have got different kinds of newer set of implants which have come and which can take care of, the failed knee replacement also. But in India, the most common cause of revision, which we call the failure is a revision, is infection. It's not that, it's a worn-out implants. So that is a entirely different scenario compared to, the failure of the implant. Here, the implants are not failing. The system, we had to remove it because of the infection.
Okay, so it is infection that affects.
It is the infection is the most common cause of revision in India.
Okay, so what if when it comes to age groups, which age group usually have these knee replacement surgery? Is it age specific?
it's not knee replacement is something which we do to improve the quality of life. It is not specifically age specific. It's like most of the patients we do knee replacement are more than 60 years. We keep 60 years as like a benchmark is because you take this 20 years thing in your mind. If you look at the life as such, people say at 60 you age and you retire and all, but that thing has changed. Now we take it as 70, like till 70 people are working. And if you see the activities of people, till 70 they do normally, like after 75 they start slowing little bit. They also feel like you are having some little bit of aging. And after 80 you will slow really well. So we want something, like a knee done at 60 years. So even if it is having little bit of problem, by 80 years the demand of that patient and of that implant will be less, so that they can carry on with that same implant till they have been called to heavenly abode. So it's not that I have done knee replacement for a 17-year-old girl to my eldest patient is 92. So it varies depending upon the need. And younger patient, the scenario is different, where you have, like arthritis leading to severe crippling, where she cannot survive without doing a knee replacement. 17-year-old girl, if she doesn't undergo a knee replacement, she will not be able to go to college. She will not get married. She will not be able to complete her life. So it is the demand. What basically is the pain is the indication for the surgery. If the patient is having severe pain and deformity in an younger age group, that make you, confined to the house. What do you think, Sona? If you get confined at your age at home, how will it feel like?
Yeah, sure.
So knee replacement is basically the quality of life improving surgery. It is not an emergency surgery or a surgery which 100% everybody has to undergo. It is just to improve the quality. It is like you going to a beauty parlor. so, yeah. So if you feel like, it's the pain in the knee and the problems of the knee is affecting your daily life, you get your knee replaced. So age doesn't matter. But generally, if you consider the age, it's basically we do it in elderly population. That's more than 60 years. It's more than 60 is not elderly, by the way. So basically, it is an aging surgery.
Yeah, that is actually unimaginable. A 17-year-old girl.
Yeah. And now she got married and she got 2 kids also. She's working in Dubai.
Okay, so she's doing whatever she wanted with life.
Yeah. Let us see when, like the problem of knee replacement, actually there are 2 types of patients who come to us. I mean, we will say it's 3 types of patients. One is the patients who come because of the arthritis issue, like a rheumatoid arthritis or an arthritis profile patient. That is, they come in the younger age group. That's what they come in 17 and all. The other group, the extremes of age, is because of the age-related wear and tear leading to arthritis. And there is a group in between that is known as a traumatic arthritis, where you had a fracture,
Okay.
which will, some fractures are really bad. Even if you fix, in the best possible way, also you may not be able to get the proper, correct way of alignment. So that can also lead to an arthritis.
Okay.
So both the groups, the one with an rheumatology issues like rheumatological arthritis and the degenerative arthritis, those patients do very well. Because they have got other problems, like their hips may be involved, their hands may be involved. They will have other kind. They will be generally slow. But a traumatic arthritis, like you are going today, somewhere you met with an accident, you are absolutely fine. Your all other joints are fine. You only had a problem is in the knee or the hip or wherever you have a fracture. So those patients will be completely mobile and they won't understand basically how much is the problem. Like an elderly patient, they will, degenerative arthritis. They slowly had a pain for years, and they have understood what are the issues. But traumatic patients, trauma arthritis, they will do whatever they like with that knee because their all other joints are fine. So they will feel like I want to do all the things what we were doing or my peer group is doing. So they may not be very happy also, by the way, because they will not be able to do completely what their peer group is doing, but they want to do and they will try to do and they will come up with the implant problems later on. So these are the group of patients who can have a failure of implant earlier. But generally the rheumatology issues at the rheumatoid arthritis and that group also do well, and the elderly degenerative group also do pretty well.
Okay. So what happens if this younger group you just mentioned, if that younger person is an athlete, or will it affect their performance?
We generally don't advise to go for any professional games other than golf. You
Okay.
can go for playing golf.
Why is that?
Because the knee replacement as such is designed for the pain relief and for a normal activity. So it doesn't mean that you can go and play football with that.
Okay.
Or you can go for normal walking, you can go for swimming, you can go for, like um, golf or something. You cannot go and play football or a rugby with a knee replaced knee. If you go and do that, they will fail earlier because you are not supposed to do, they have limitations in their movements. So that is the problem which we were discussing now also. The post-traumatic or the post-athletic, it will not get the natural knee. Only God can make the natural knee. It's not possible. God is something different, and we humans cannot, whatever you do, humans cannot recreate what God has given us. So that is there. So athletes, we generally don't advise to go for active, that kind of contact sports, what we call is contact sports. But we can go for recreational sports, not for, a high level sports.
Okay. So it do affect their performance.
Yeah.
Okay.
It will not affect their weight, it will affect their knee also. That will get burned out.
Okay. Yeah. Got it. So if this is the condition, patients might delay their surgery because they might be afraid about losing their career or something. So what is your thought on that, about delaying a surgery or going for
So
alternative?
I think your concept of knee replacement is totally different. You have to understand that knee replacement is done for patients who is suffering from pain. And my professor told me, the indication for knee replacement is pain, and pain is the indication. Do you think a patient who is suffering from pain, whose activities of daily living is affected, would like to go for contact sports, for playing and all? They will never go. They have been in the house, or they have been, they are just able to do their activities only. So those patients are the only people who are, who are the candidates for a knee replacement. So others which you are talking is all the patients in these sports people are having is a ligament injuries, meniscal tears. They will all, like get their ligament surgery done. They will go back to their sports. I have patients who have undergone ACL reconstruction with me who is playing now in the Spanish Football League. So that kind of athletes coming up for the knee problem is an entirely different scenario. So if these athletes doesn't get their ACLs or the meniscus done at the right time, they will be an ideal candidate for a knee replacement after 15 years or 20 years. So by correcting those smaller injuries, we can avoid knee replacement, or we can even delay the knee replacement. So that athletes are basically people who are between like 15 years to 35 years. They are they are those people who are high level and players. They comes. So we are thinking about something which is happening, a surgery which is being done in more than 60 years. So at 35 years, we generally don't do any replacement. Generally, that's a general thing, especially for traumatic. So these people will be coming, all these athletes will be coming with a ligament injury or a meniscal injury. You treat them well. Even if they require a knee replacement, it will be after 60 or 70 years. So if they don't treat that injury properly at that younger age group, they will become unarthritic and they will come for a replacement surgery. By that time, they will be out of the game. If they don't treat their ACLs or the meniscus or whatever, ligament injuries happening in the knee when they were at an younger age group, they will be definitely out of the game. So the treating an athlete is completely different scenario. So we have to get them playing in the next season. Maximum is only one season they can afford. They cannot afford 2 seasons. If 2 seasons mean you have got a better person coming, like doctors also. If you are out from the field for 1 year, then you come back, you will not get. There will be somebody else who will be sitting there doing a better job than you. Same thing in your field also. If you are here now, if you are after 1 year you come back, it is very difficult to get back to your position what you are now.
Yeah, exactly.
Same thing.
So, when we leave the sports part apart and when we talk about general people, they also delay their surgery because of their fear of surgery or something like that. So, when do patients know that they should do a surgery? Because they might be doing some physio thing. You just said that people, first, we don't recommend knee surgery in the first place itself. So, when they exactly know that they have to go for a surgery?
For a knee arthritis, the most common method of treatment is exercise, weight reduction, that's a general treatment, and then medical treatment. Then you have injections. Then the last resort is only surgery.
Okay.
So if you sit in a OPD, if you see 100 patients with arthritis of the knee, less than 5% will be only candidates for a knee replacement surgery or any kind of a surgery. So if you take knee arthritis as profile, got 4 stages of arthritis from the medical side. Okay, we'll have a medical side and a patient point of view.
Yeah, okay.
So the medical side for stage 1 and stage 2 of arthritis, that usually have the patients coming up. If you look at the entire population, the age group will be around 40s and 50s. So their basic treatment will be weight reduction, especially now we find most of the, even I was like that in 30s. I was I started putting up weight because you are busy with a lot of other things. Because of your career, you will not be able to give proper attention to your body as such. So by 40s, starting of 40s, you will get all the diseases. You will be having diabetes, hypertension, and you will be 100 plus in your weight. And if you continue with that, I have reduced my weight a lot. I reduced almost, now I have reduced around 15 kgs from what I was in 40s, early 40s to now 50s. So if you look at that thing, I would say that in 30s, you should not put weight. That's the most important thing for an arthritis profile patient or whatever, for generally for other lifestyle diseases, what we call. So in 30s, if you are able to control, you can have a very good life in your 80s. So you should be able to control your 30s and 40s. So these kind of a patients, you try to reduce your weight, you go to the gym, you do regular exercise, you have a diet control, and that is good for the stage 1 and 2. And sometimes, if you have some kind of this, when you are into sporting activities, if you have a ligament injury or a meniscal injury, you treat it properly so that it won't progress. For a stage 3, that is the most common group of patients who presents into the OPD. 1 and 2 may not be presenting to the OPD. They will not have any much symptoms other than some dull aches and pains, which they are also busy. They won't come to the OPD. So those people coming to the clinic will be having either stage 3 or a stage 4. So stage 3, we generally give them, medications. Now there are a lot of injections which is there, like PRPs, then lubricant injections. But the value of PRPs and lubricants are still questionable. Since there is nothing else, we give that. But it is still debatable that it's scientifically not proven any of these injections have any effect on the disease per se as such. So you gives again lifestyle modification, medications, then gym training. And if there is any of these degenerative tears or something, you can, especially what you can get is a meniscal root tear, which can be repaired. That can prolong your knee replacement. We can avoid the knee replacement, but we can, like a 45 or a 50 or a 55-year-old getting a meniscal root tear with a degeneration, or with a, sometimes you can have a malalignment of the limb. Your body limb get malaligned. Normally your knees are in a outward direction. Sometimes it can go inward. So if you correct your malalignment, then also your arthritis can be, development of arthritis to a stage of knee replacement can be prolonged. That is, in case of 50s, you can prolong it to 60s, where ideally the knee replacement candidate, they are good for knee replacement. So then we come to, stage 4. So in the x-rays, many patients have a stage 4 arthritis. They may not have symptoms. They may not be having pain. They may not be having any other issue. They can continue with that. So if it is painful, if you think that it is getting affected your activities, then it is better that you do your surgery early. Otherwise, once you are slowed down really badly, like you are only, you are bedridden, you are not able to walk, it is affecting you, affecting your muscles. The muscles will be weakened. It will affect you psychologically. You will be down to the bed. So it will entire, this particular individual will be both structurally, that is by his body, and by mind, psychologically it will be affected. So it is always better to do the surgery in those patients early. So again, there are another set of group of patients who are scared of surgeries. They will again go for many alternative treatments, and they will come back to us in a very late stage. They will have all the complications. So because their muscles are weak, they will have a very advanced arthritis. So the surgery will be more complicated. Generally, a knee replacement surgery takes around, in my hand, it takes 15 to 20 minutes only. But a complicated, case can go prolonged. If the surgery gets prolonged, the chance of complications are high, infections are high.
Yeah. So actually, the surgery has a high success rate, right, compared to other surgeries. So what could actually go wrong in these surgeries?
If you look at knee replacement as such, around 85 to 90 patients of percentage of patients are really happy.
Okay.
So that we call the patient perspective, not the surgeon's perspective. For surgeon, all the patients are successful. So for that, from the patient side, like 85 to 90% of them are happy. So if you ask them whether you would recommend the surgery to somebody else, like 85% of them will say you will recommend.
Okay.
So you have next the 10%, that 85, between that 10%, 85 to 95%, that 10% group. They will be, like happy, but not very satisfied with the outcome, but they are okay. Again, they will also recommend the surgery. But they are okay. They will be always, like, I'm not happy with what, somebody else had a better result. That's a normal thing. And 5% of them will be really unhappy. They will not recommend surgery. They will have problems. And one person will always curse the doctor for doing this surgery. So this is the general trend. It's not my concept. It is the patient, what we call this patient satisfaction studies which have come out, I've told. So now the knee replacement is evolved. We have got robotic knee surgeries coming in. So we are trying to focus on that 1% of patients to get them also into at least to that 10% group. So the satisfaction of the patient is entirely different. The result of what doctor, I will think that this patient is doing extremely well. I had recently a patient who had, whose knee was bent to 20 degree on one side, another knee 10 side, 10 degree. He came with very difficulty. He's an engineer by profession. Okay. He was in Gulf. And his knee got straight. He's walking comfortably, but he's never satisfied. I was really satisfied. He was walking comfortably. He's walking, coming, no pain, nothing. But my knee is not, as what I was thinking.
Is he experiencing pain or?
No, he is telling that you think that something artificial is there. But his expectations were totally different.
Okay.
So Again, counseling of the patient is really important. When you go for any surgery, especially an elective surgery like a knee replacement, so which we may not be getting time every other patient, we may not be able to do that. But I think that is the most important key for success of a knee replacement. So for any patient who's, as your question was, when they are, if they are scared of surgery, if you are scared of anything, if you are scared of getting into the aeroplane, you will never be able to go to US, or you will not be able to go to Dubai. So if you remain scared in your life, you will remain every time confined to home only. So I think that is somebody's mindset, which we will not be able to change. And they will try all these alternative kind of treatments, and they will come with very late presentation with all the complications, and they are the most likely candidate for a complications of surgery. And if you again come to the second part of your question, what are the untoward incidents which can happen for a patient undergoing knee replacement? Most untoward incident which can happen is death of the patient. Okay. So, knee
Especially
replacement.
scared at this point.
Yeah. Because you can have something known as a pulmonary embolism. Very recently, we had one of, in yesterday's paper, there was in one of the, in another main hospital in Kochi, a 22-year-old patient who was undergoing a ligament surgery died. Because that is because of pulmonary embolism. He had an accident. He was in the bed for almost 1 month. So in those patients who are bedridden and you have got little prolonged surgery, there is high chance that their blood vessels in their leg can get blocked. You can get clots in the blood vessel, which we may not be able to recognize early. So that clot can get into the heart or into the lung and can lead to sudden death. So that's the most untoward incident which can happen. So those who are hearing me now will, those who are scared of surgery will not run away now. Okay.
Exactly. We must be needing real counseling for those people.
Yeah. So the second commonest thing you can have, the most common thing in India, as I've told, is infection. So we generally, like in our hospital, we work up the patient at least 2 weeks before get everything, whether the patient is having any infection, try to do. We have got a very sterile environment for doing surgeries. Our theaters are specially equipped with HEPA filters, laminar airflow, V-wares, hood for this surgery. And we limit the people entering and going out of the theater. We don't want a traffic inside the OT. We limit everything. So knee replacement, we follow a strict standard protocol where we try to limit the chance of infection. But then also, if you look at it, the entire number in a breast center also, you have got around 2% chance of patient getting an infection.
Okay.
So, but generally, like if you look at our part of the world, it is actually less than 1%. Our numbers are less than 1%. But if you get an infection, you should treat them aggressively. That's the most important. If you treat them aggressively, you can get out of that. The third problem which commonly happens in our part or for coming for revision is a periprosthetic fracture. We call a fracture which is happening around the implant.
Okay.
So because of the bone is very weak, because they were not walking, they don't come at the proper time. And especially most of the knee replacement patients are women, elderly women. So they have got severe osteoporosis. So either we have to treat the osteoporosis. So that's why I treat osteoporosis so that my patient won't develop a periprosthetic fracture. So periprosthetic fracture, you had a slip or a fall, you have a breakage which is happening around the implant. So that is entirely different from, the treatment is little different from a normal fracture. So we have to see whether the implant is stable, implant is not stable. Then if the implant is not stable, you have to remove the entire implant and put it. And putting a normal plate and screw or a nail will be difficult because we have got this implant sitting there. So that is the third commonest cause. And the fourth cause is a complication is that you can have the wear of the implant.
Okay.
So these are the things, and the wear of the implant is the comes the most below in the ladder among the complications. And if you are doing a good job, I'm telling about if you are going to a good surgeon and doing a good job. Otherwise, if in a surgery, if you are not able to put it correctly, because nowadays knee replacement is done everywhere, so people who are not even properly trained are doing surgeries with the help of technicians and all. I think that's a different scenario. So it is wise for the patient to choose their surgeon and the hospital and get it done properly. So if it is done properly, these are the four major causes of or the complications which can happen.
Okay, so people might be needing exactly good doctors like you for the surgery.
Yeah, I'm not telling me, there are a lot of others also here, but you should choose a surgeon who is properly trained in doing these surgeries.
Yeah, sure. So people having these severe knee pains should go to hospital as early as possible.
Yeah.
They might not delay their surgery.
No, it's not delayed. They should not delay their treatment. I'm not saying you should get surgery is not the only option for treatment.
got it.
So you should seek a good professional help to sort out. So it's like you have like you, Sona, you told you're an engineer, so you have a virus sitting your laptop. If you treat it, you have your given to a proper professional. You can save all your data, right? So if you're not able to give it to professional at the correct time, your entire data will go. Same thing. You have a problem, don't ignore it. You get a proper professional advice and take a proper treatment. Don't go for your neighborhood or your conbursary, other lady telling that this was done for another lady, and some non-medical people advising you. You've got so many big hospitals now in Kerala, and there, if you look at Kerala as such, it's such a medically advanced state. Even if you go to any developed country, you may not be able to see such big hospitals in a smaller area. So you should take a proper advice, at least take a proper advice, then you think about it, and you can take a second opinion also if you like to have. It's not like you don't take second opinion. I was again second opinion people when it comes to me, I also get irritated because some good friend I've advised a surgery, but it's a mindset of some people that so I think we have to adjust to that. So you first thing is that you have a problem, don't ignore it, take it and have a good professional advice. And then if you have a doubt, you take another advice also, and then you decide on yourself. Don't ignore it.
Yeah, so we must not actually ignore if we are experiencing severe knee pain. So, doctor, actually, we got a surprise for you here. So, we are having a patient of Dr. John here. So, I think she must be the perfect person to explain more to you people. So, doctor, can I switch places with Annie so that she can have a conversation with you?
Yeah.
She'll be hosting you from now on. I'm switching
Yeah.
places. So,
Annie Andy is a very wonderful patient. She is very known to me, and such an enthusiastic patient who really coped well with the surgery. So really happy to see Annie Andy coming, whom we did the knee replacement last year. It's almost just 1 month now. Surgery being done at last February 10. So I think this is a wonderful idea that a patient is interviewing the doctor. Let us see what Andy has to tell and what Andy has to ask the doctor. So that will be really good for people, as from the patient perspective. Till now, you have been hearing only a doctor's perspective or somebody who has never suffered this. I have never suffered knee pain. I have never suffered the problems of a knee replacement surgery. I have seen only, but I have never experienced. So it's always good to hear from the experienced person.
okay. So, let's see how the patient interviews the doctor.
Hello, Dr. John. Good morning. Yeah, it's a very surprise to be here with you this morning. And my name is Annie Jacob. I'm 66 years old. I was suffering from rheumatoid arthritis for last 15 years. And it started with a pain on my hip. Then gradually it moved to my leg and to all the joints. And for last 35 years I was in Saudi Arabia, and there that treatment was impossible. So finally we had to quit our job and we came back and settled in Ernakulam. And from the time I was, my nearest hospital was Lourdes. We were consulting the rheumatologist and the treatment was going on. And first 10 years, it was okay that, I could walk. And gradually after 10 years, the aches and pains started all over my body and hip, then to the knee. Yeah, and lifestyle became a little difficult. I could not move. I cannot travel. My main happiness is traveling. So I cannot sit on a car or any transport for a long time, and I cannot sit and read. I cannot write. Then the daily task became very difficult. So from the rheumatologist, the next room was Dr. John's room, orthopedic. So I just thought, I'll have a consultation with Dr. John. So he told me to take an X-ray. Then from the X-ray, we started this journey to the knee replacement surgery. So for the quiet surprise, the X-ray only proved that I am having problem with my knee, the degeneration of the cartilage. So his advice, and I followed his advice. And last February 10th, I had my surgery at Lourdes Hospital with the angel on earth. I can explain like Dr. John and his team. And the surgery went very smoothly. And the best part of the surgery, and because before the surgery, we will consult many people, those who had knee replacement surgery. So most of the people, 80% of the people, they said, don't do it, don't do it. It's very painful. And I got scared. And I was thinking, I was praying what to do. Then finally, I had the trust on the doctor and the hospital. Then he said, Andy, nothing to worry. You come and we will have a pain. There is a pain management. And with a great satisfaction in my heart and with the prayer, I went to the theater. And from the theater, I could see the warmth, that comfort, the passion, the kindness I got and received from all the doctors and the anesthesiast and the nursing department. So passive, so good treatment, and it was full satisfaction. And after coming to the room, from the post-operative room, and the very next, that night I had some pain. The next day, doctor came to my room and for the checkup. He said, Andy, I will give you the pain treatment. And after I've taken to the pain management, pain intervention, that most of the people, they don't know and they doesn't know about it. And that is a great comfort, great satisfaction. The happiness I'm sitting now, now it's only 30 days after my surgery, so relaxed. And because of the pain management what doctor has given, and after the second day, he made me walk into the corridor of the hospital, and all the doctors, they came to see how I am walking. And from the second day onwards, I am walking, doctor, with happiness. And I feel, the aches and pains that reduce the quality of our life, and everything will have to depend on the husband or, others for everything. So we know we are troubling them, and when we cannot do the things what we expect a day with our daily routine, it's really a total mess. And so many, and slowly our happiness, our strength or enthusiasm, energy, all were decreasing. And now after the surgery, I'm really coming up. Now I have the confidence. I can go, I can move. After that, you said 45 days of rest. So I'll have to carry that. And to doctor, I want to ask you, the question is, why most of the people are scared about this knee replacement surgery?
Thank you, Annie and Dee, for coming early morning here and be with us for this wonderful program by Minu and team. So, I think, why? Because, why scared? Because they have never experienced what is happening. So medical science is really advancing day by day. So if you look at what a normal labor which you had undergone so many, maybe 40, 50 years, 40 years back, that has changed.
Change, yes, true.
Now we have got a labor analgesia because you have got a painless delivery now happening.
Yeah, correct.
Which you may not be able to think 40 years
Yes, back.
back. Same thing, the knee replacement has evolved a lot from what it started. I saw first knee replacement when I was a first year MS student in FMC in 2000. That is now 26 years, exactly 26 years back. So I joined in Jan 2000. So exactly 26 years back, I saw the first knee replacement. It was a big thing. As a first year postgraduate, I was not even allowed to enter the operation theatre. I don't know whether Andy knows why an operation theatre called a theatre,
Yeah.
because we have got in a medical school, you have got in the top of the operation, room, you've got a glass area where the students will be watching from top what is happening. That is why it is known as an operation theatre.
Okay.
So a first year PG, as a postgraduate, I was sitting on the top and watching from down. What is this professor and my senior colleagues are doing this wonderful surgery, which, like getting into orthopedics, my dream specialty, my passion. I always thought I will be inside the surgical team, not, on the top watching something from down. So that made me really curious. And when I got into second year, I was allowed to be in the theatre.
Okay.
And when I was in the third year, I was allowed to, assist in joint replacement. So that was the scenario in India in early 2000s, like that changed when I went to Singapore. I went for my fellowship there. It was just another routine surgery, like if you go there, we had a lot of issues of getting operation theatres there. Then people are doing in daycare surgery also knee replacement. Knee replacement every day is happening.
Okay.
Then I went to UK. UK, it's like knee replacement is a very common surgery, like what is happening now. Then I had a short, like we went for a 2 weeks to Germany, where there is a big room. You have got 4 operation tables lying there. In the 4 operation tables, you've got knee replacement happening. So it's just like, you get into this big room. Get into this big room. You have got 4 tables lying there. At least, every table there is 4 knee replacement happening. So that means in that room, 16 knee replacement happening in a day. So that all changed the perspective, like knee replacement is not a big, surgery like only professor can do surgery.
Yes.
The concept has changed. So it's like mere mortals like me can also do. So that's what I learned. And then, when we came back, when I came back and joined Lourdes in 2007, it was again, I did the first knee replacement in Lourdes Hospital. So it was again a big thing, you're not allowed, anybody is not allowed to enter the theatre, all those stuff. But that has changed, Nowadays, if you look at from 2007 to 2026, 19 years in Lourdes Hospital, last year itself, we have done around 400 knee replacements. So it has become the most common surgery I perform or the Department of Orthopaedics in Lourdes Hospital perform. And I never thought that, I will do a robotic knee replacement. So I also have robot in my theater. So we do robotic knee replacement, the knee replacement improved. So now, surgery time is very less.
Yes. You have taken not even 30 minutes.
Yeah, we finished, I think, around 20 minutes. Your surgery was.
And when you said, your surgery is over, Auntie, I got surprised, and because I was looking at the clock on the wall.
Usually by 20 minutes we cement and I will be out by around 25 minutes. So the things have changed. And again, I'll say any work is a teamwork. It is not that I alone do the surgery. you should have a good team. So I'm blessed that, I have got a very good team with
Team, yeah, really.
I got, as you met, the rheumatologist also comes with us. We have got a pain management with Dr. Tisha. We have got a very beautiful anesthesia department
Yes,
under
yes,
Dr.
they were
Chopra.
very comforting, yeah.
So, which is the most important thing, like if you don't get a good proper anesthetist, because we will be, as you know, I have 2 operation theaters running simultaneously. I will be pushing out. Once the patient enters the operation theater, till they are out of the theater, entire thing is taken care by the anesthetist.
Yes, yes.
And we have got a very beautiful nursing team.
Yes, yeah, correct.
They are very dedicated.
Really, yeah, dedicated.
And they give lot of soothing to the
yes.
to the patients, because as doctors we spend hardly 5 minutes to 10 minutes, maybe, like you are admitted in for 72 hours in our hospital. The amount of time I spend will be hardly 15 minutes.
Yes.
But most of the time is spent by the nurses and my junior colleagues.
Doctors.
And they all are, somehow our hospital is blessed to have good doctors coming to work in our team.
Yeah.
It is
Very friendly, very warm. And
not friendly and warm, also they are dedicated to their work, and they really, which is really difficult to see in the present medical scenario.
Correct.
I think we are good to have very good team with us. So, as such, if you look, the scariness is because, as such, from when you are a child itself, what your mother or your grandparents tell you is that if you don't do this work, I will take you to the hospital and ask the doctor to give you an injection. So the scariness will start from when you are an infant or when you are a child itself, Hospital and doctors are somebody who are scary. So that is change, Once you come only, you will experience that, it is not scary. It is a friendly environment, and especially for people who, who come there for really a problem.
Yes.
There are people who comes to hospital for creating problems and not with their problems. So these are 2 groups of people who come to the hospital.
Very true.
So it is not scaredness, as you told, for a knee replacement surgery, you were there, second day you were discharged home, you were walking without any support. You were asked to walk on the next day itself. Even sometimes we make the patient walk in the evening itself if you have a smaller list. So I generally want my patient to walk, once they are comfortable. Don't, exert them too much. So our team does a good job.
That was a great, everyone was even to have a walker for 1 month, then stick. But from the second day, you said, no need of walker, no need of stick. I just walk with my 2 free hands. And it was like a surprise. And after the pain management, that intervention, when I came back to the bed, I thought, where was the surgery done? Even I didn't know, the total pain or, that leg was feeling so free. So most of the people, they doesn't know about this pain management.
And pain management and physiotherapy are actually an integral part of orthopedic treatment. So that is basically the pain management goes with the anesthesiologist or those people who are specialized in pain management from the anesthesia side. So as such, then another group of people we have to involve is a cardiologist. You have to be taken. You have to really take care. Because we deal with elderly patients. Or most of the people are coming for a knee replacement, elderly patients. So they can have a cardiology issue also. So I feel like a team. This kind of a teamwork is really, really important.
And I'm so blessed, doctor, to, you are like, once again, I'm telling, an angel on the earth. And the main thing is for a patient or when we go to the theater is that, that strength, the inner strength. And all the doctors around me, nothing to worry, we are with you, no worries, no. And I said, where we will get such comfort, the passion, that all were like, I am theirs, like that feeling. And it was really a great blessing in my life. And my quality of life now. I thought, all my good days are gone. I cannot be back to my work and the things. But now I got the hope back. I can stand, I can walk. I was a person, I go like, flying all around. So when I started sitting and lying down last 2-3 years, I thought really my life is gone. But after doing this, I feel, my life has come back. I can do. Same happened to my brother also. He was also always saying, "Oh, my life is gone." You are the one who did the hip surgery for him, and he's now so happy. He said, "I'm back to my normal life after doing the hip." And same thing I was asking him when he did the hip surgery. And don't you have pain? He said, "No pain, no pain." And I was wondering how it happened. Then when once I experienced, I'm telling all the people around the world, those who are suffering with knee pain, it's nothing to worry about this. As doctor said, that new technology, medical facilities, improved medical versions that can really help you and cheer you and bring your quality life back. That is something great. Because as we age, we always think, "Oh, I'm aging, my life is gone." And plus the aches and pains, and especially like rheumatoid arthritis, it's a degeneration. But, once we can get back to our, that energetic life, something a great blessing, doctor. And really thank God for this medical team, medical interventions, medical technologies, and that surgical process, everything.
So can I ask you, Andy, one question? Like, why did you think that the surgery is really scary? Who made you think that the surgeries were scary?
Because when we talk about the surgery, those who have done the surgery, the people say, "So it's so painful. I had this," and they only say there's lost stories, not the happy stories. So when I'm telling after my surgery, when I'm telling my happy events happened, they are really surprised. It's because we keep on asking people, even my own cousin, first cousin, he had knee replacement surgery in USA, Chicago. And now it's still 3 months, still he's suffering with pain. So he keep on asking me and texting me, "How, auntie, why you don't have pain?" Then I explained to him, I said, "You come back, you come to India and go to Dr. John. I'll get you better." And he said, "Even we have all this facility, but the pain still is undergoing pain, even 3 months,
No,
still on pain."
yeah, but these are some people. Maybe he belongs to that like the last 5% group where they are not very happy. So we don't know.
No, as doctor said, no, that he had the accident, trauma. Then he had to do the surgery. He was very active. And he was a good soccer player.
Yeah.
Mm.
So if his expectancy will be totally different,
Different,
from what
yeah.
you were thinking. So again,
But-
patient mindset is very important
Yeah,
for the
that's also
satisfaction.
there, yeah.
So everybody, it
Yeah.
varies with each people to people.
And always I feel, from what I feel, when we go to the hospital, we should go with a positive attitude. The doctors are there, that God has kept it for us, and they will treat us well. They will do good, and our expectation that is really will happen, no, doctor?
Yeah.
So I was really happy, and I thank God and thank Lourdes Hospital, and thank you, doctor, for your blessed hand and your passion, compassionate, kind heart, and your team. And your team is also appreciating a lot, because of Dr. John, we can do, and very friendly doctors, very friendly. And in the theater, they were asking me questions, "Auntie, if this song is enough, you want another song?" The music was playing on one side, all that that old songs, and you were talking, and all we can hear, no, like
I recently had a, one singer, one famous singer's husband came for the surgery, and we thought he would like to hear some songs sung by his wife. But then he preferred some little older Hindi songs. So, so it's always fun that you were able to do what passion you had. Now people are really worried whether people really want to take medicine or. So if you have a passion for for something, again if the God blesses you, then the things will work.
Yeah, even my brother also said, no, while after the surgery, doctor asked him, he's also a good singer. So doctor asked him, you want to sing a song? He said, okay, I will sing. And then the last part of the song, the last two lines, all the doctors and nurses sang along with him. He said, what a blessing we have. Really, doctor, it's something, great. And, getting back to our quality life, that is very, really, really, no words can appreciate or no words can express our gratitude. Thank you so much, doctor.
Thank you, Auntie, for coming all the way and spending time
It's only
with us.
30 days after my knee replacement surgery. I'm here and with full satisfaction. And after all, it's all God's, as you said, it's all God's blessings. And the best hospital, we have best doctors, we have best nursing care, and best team. And now when we come to the ender itself, all the nurses and the assistants, they come, oh, Auntie, good morning. What welcome we get in a hospital.
Everybody knows you very well now.
That is great, doctor.
Okay, thank you, Auntie. Thank you very much.